My name is Dr. Jason Jancosko. I'm an orthopedic surgeon specializing in sports medicine and joint reconstructive surgery for the Orthopedic Center. Majority of care and basically what my expertise is in sports medicine, but we see a variety of patients on a day-to-day basis with general orthopedic problems. So on any given day in the clinic, I may see a number of patients with diffuse and musculoskeletal type of injuries. These can involve injuries to the joints, which are both fresh acute type of injuries or traumatic injuries or chronic degenerative type of things. These can be of the shoulder, which I primarily see shoulder, hip, and knee problems. You can see anywhere from a young student athlete with a shoulder problem to an older person with the same type of shoulder problem that we diagnose, for example, on an MRI. But for those two patients, you may treat them extremely different, whether it be non-surgical and surgical treatment. And the ability that I have to follow them from the very beginning of their treatment through physical therapy, perhaps other conservative treatment measures, all the way through occasionally surgery, and then hopefully see an excellent outcome that they have. It's really gratifying to be able to follow them really start to finish. So one of the things I do as a sports medicine physician is go out along with Dr. Mason to treat a lot of the local high school athletes. I cover Queen Anne's County and North Carolina high schools, and as of recently as well, Chesapeake College athletics. So I'll get to spend time with the athletic trainers, work very closely with the care of their athletes, getting them back in shape and back on the field. My medical school training was done in Philadelphia at the Philadelphia College of Osteopathic Medicine, where I spent all of my medical school training. Then I stayed on and did a 5-year orthopedic surgery residency. Upon completing that, I went on for further subspecialty training in sports medicine in Southern California. I remember when both me and my wife were in California completing our fellowship, I began the process of looking for jobs just like any other person would after finish their schooling. And we came across a little place on the map I never really heard of. I heard of the Chesapeake Bay region, but never really of Easton. And I called the company up. It happened to be the Orthopedic Center, and had spoken to some people here. It sounded very interesting, and both me and my wife came out for the weekend, and we really fell in love with the area, literally in a weekend. The Easton area in Talbot County in general has a number of outdoor activities, and I like the idea of a small community setting, not only to live in but also to practice in.